Right.
We'll call the County Human Services Committee meeting to order. You receive copies of the minutes. Any corrections or emendations?
I move to approve, Mr. Chairman.
Motion to move. Is there a second? Discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, same sign. Motion hereby carried. Jenny, you have two resolutions to present, both of which have been, you've kind of given us some precursors over the last several months, and we've known now for a year or two that 19 is going to be the key. So if you would proceed and give us the technical one-pager in terms of the details.
Sounds good. So my first one is going to be Resolution 2019-02, Kandiyohi County Managed Care Organization Procurement Recommendation. Whereas the Minnesota Department of Human Services has published a request for proposals to provide healthcare services to recipients of medical assistance for families and children and Minnesota Care in 87 counties, including Kandiyohi County. And whereas the Minnesota Department of Human Services has requested county evaluations and recommendations regarding the request for proposals from each respective county, and whereas Prime West, Blue Plus, Medica, and UCare submitted proposals to provide managed healthcare services in Kandiyohi County. Whereas representatives of Kandiyohi County Health and Human Services have reviewed and evaluated the proposals, and whereas Prime West's proposal was found to be superior than others in meeting the needs of our Kandiyohi County consumers for managing care and accountability for health, quality, and consumer satisfaction. Therefore, be it resolved that Kandiyohi County Board of Commissioners, acting as the Human Services Committee, supports the recommendation of Kandiyohi County Health and Human Services Director by approving Prime West as the sole managed care organization that should provide managed healthcare services in Kandiyohi County. Therefore, it be further resolved that Kandiyohi County Board of Commissioners believes that single plan arrangements in rural counties does enhance integration and coordination of healthcare services, resulting in cost savings.
Mr. Chair, I would move this resolution.
We have a motion to accept the resolution. Is there a second?
I'll second that, Mr. Chairman.
Seconded. Discussion, questions? Hearing none, all in favor, please say aye.
Aye.
Opposed, same sign. Motion is likewise carried. Thank you, Jenny. Proceed to the next one.
And the next one is Resolution 2019-03, Kandiyohi County, Minnesota Senior Healthcare Options and Minnesota Care Senior Plus Procurement Recommendation. Whereas the Minnesota Department of Human Services has published a request for proposals to provide healthcare services to recipients for Minnesota Seniors Healthcare Options and Minnesota Care Plus in 87 counties, including Kandiyohi County. And whereas the Minnesota Department of Human Services has requested county evaluations and recommendations regarding the request for proposals from each respective county. And whereas Prime West, Blue Plus, Medica, and UCare submitted proposals to provide MSHO and MSC Plus managed healthcare options in Kandiyohi County. And whereas representatives of Kandiyohi County Health and Human Services have reviewed and evaluated the proposals, and whereas Prime West's proposal was found to be superior than the others in meeting the needs of Kandiyohi County consumers for managed care options, accountability, healthcare, and quality customer satisfaction. Therefore, be it resolved that the Kandiyohi County Board of Commissioners, acting as the Human Services Committee, supports the recommendation of Kandiyohi County Health and Human Services Director by approving Prime West as the sole managed care option that should provide MSHO and MSC Plus managed healthcare services in Kandiyohi County. Therefore, be it further resolved that the Kandiyohi County Board of Commissioners believes that the single plan arrangements in rural counties does enhance integration and coordination of healthcare services, resulting in cost savings.
Heard the resolution. Is there a motion or
I
questions?
will make that motion as well.
Commissioner Nissen moves. Is there a second?
I'll second.
Commissioner Berg seconds. Discussion, questions?
We were at the Prime West presentation a few weeks ago, and they did a very good job of describing how they operate and where the benefits truly are for us as in a health organization. And so I totally concur with the decision of her group, Jennifer, and the folks that looked at this, that it is truly in our best interests to go with Prime West.
And Mr.
Fee
Nissen,
that we also get, some really good side benefits from the savings that we wouldn't get with another organization.
Right.
and Commissioner Nissen, Prime West has proven for year after year after year that is exactly the other counties that have participated, and the outcome has been very, very positive.
Yeah.
We knew that the reauthorization was going to occur, and we knew there would be competition. That's why timing is about as most appropriate as you can possibly get. Questions or discussion? Have a motion in a second?
Just a quick comment. I've talked to you before about this, and I just want to really commend you and your staff as well for getting up to speed so fast. And it took several other reports that you had to submit and go through and fill out and rate and so forth to get to this point, and a very good job.
Yep. Thank you.
Mr. Chairman?
Mr. Alman?
Jenny, thank you for doing, are there any obstacles that you see that we're going to be facing, or you're going to be facing with your staff on this transition, this change?
Until we get, until the DHS sends us which managed care organization we're going to be receiving, we really don't know what that looks like at this time.
Thank you.
Hearing no further questions, all in favor, please say aye.
Aye.
Opposed, same sign. Motion is likewise carried. And then we'll proceed to the Community Health Assessment and Improvement Plan, and Sherry and Denise, please.
Signed, sealed, and delivered.
Good morning.
Good morning.
Morning.
So we are happy to be here this morning to talk a little bit about the process that we've been going through. We're calling it's developing a community health improvement plan, as well as a community health assessment, and then a community health improvement plan. So one thing I wanted to, as we start talking about this, some of the data that we'll be sharing with you is considering Renville County as well. And so just a reminder that we are a community health board with Renville County and Kandiyohi County together. Community health boards are the legal authority for local public health in Minnesota, and the Community Health Board is made up of representatives from both counties, and they work together with Minnesota Department of Health to assure the health of our community. So just a reminder, that's why some of the slides include Renville County. So, as I said, all community health boards must participate in assessment and planning, and that's one of the requirements from the Minnesota Department of Health. It's an ongoing process, but every 5 years we do a complete community assessment. So this graph shows this Kandiyohi County at the center of our planning. Solutions for improving populations are not owned by government public health, but they are shared with the community. So solutions can be found in the community, in the people, in the partners, and the organizations that are located within the community. And to uncover solutions, the community has to be part of the conversation. That enables us to have a wider lens to view what the community looks like and help us understand underlying patterns and different things that could be impacting the health of our community. So we use both our community health assessment and our community health improvement plan with our partners to identify changes that we would like to make for the future. So I just want to spend just a second talking about social determinants of health. So this is something that's been important for our assessment, and it's something that certainly impacts our community. So one of the ways that we look at our community is from the view of social determinants of health. Conditions, and this is conditions which people are born, grow, live, work, and age all shape their health. And that's what the picture shows. You can see the different things that actually all play into social, economic, healthy behaviors, clinical care, physical environment, and genes. Everything, all those things working together affect people's health. And most people think that maybe healthcare has the biggest impact on health, but really it is a combination of all these different factors. And this is a slide from Blue Cross, but I just wanted to, it brings out a good point. If you look at the bar that's in the middle, it shows kind of what the last slide did, where health happens in environment, with our behaviors, with social and emotional factors, genetics, and then clinical care. And then if you look at the bottom line, you can see where most of the healthcare dollars are used, and that is mostly in clinical care. So again, just keeping that in mind as we think about what we can do to impact the health of our community.
So now we're going to get into a little bit of the data. You all should have received our community health assessment in your drop boxes. That's a 42-page document that has a lot of data in it. We aren't certainly going to present all of that today. We have just pick and choose a few things that we're going to share with you. So that's a much fuller assessment and resource for you. Our data came from a number of different places. We did do some interviewing of citizens in our county, but the majority of our data came from either the Department of Health, CDC, Department of Human Services, U.S. Census data, and the Minnesota Student Survey and the Adult Survey data. Much of that came from PAC4 as well. They do share data. There's two different student data that comes from school surveys. PAC4, our region, does what they call a share data, and the state does a student survey. So those are a number of places that we got our data. So just to be sure that you understand that we're not going to present everything today, as you look through it, and as you maybe have looked through it before you got here today and have questions, we're happy to answer questions. If you just would like to wait till we get through this, because we want to at least be able to get through this. If we have time, we're happy to answer questions, but certainly you can seek us out afterwards with questions as well. So this one just gives you a little idea of what our population has looked at like since 1950 in Kandiyohi County. You can see the trend. We certainly are a growing population in Kandiyohi County. So over those 56 years, we gathered about 240, on average, about 247, 250 people a year. When they look at the projections, the experts that do that sort of thing project that we will probably in the next 20 years gain about 30 people a year. So in comparison, you can take a look at our partner that we work with, Renville. The opposite is happening in Renville County, which, as most of you know, is a much more rural county than ours. So they have a little bit different trend happening over there. This one gives you a little bit better idea, a breakdown age-wise to see what's been happening over between 2000 and 2016. I should clarify that for you too. We started gathering data for this health assessment last year, which would be 2018. So all of our data is 2016, because much of it we couldn't get newer than 2016 in some of this deep dive. So we just stayed consistent. So our entire assessment is mostly based on 2016 data. So this gives you what our total residents were in 2016. 26% of those were under the age of 19 and 18% were 65 and over. But you can see how that changed from 2016 where we grew. You know, we certainly are increasing in the 55 to 64, the 65 to 74, and the 85 and older areas is where we're seeing the most growth. If we look at the whole state of Minnesota in terms of, if we use the terms urban versus rural, and those definitions get very murky, so we can't say what is constituted urban because different places have different definitions of that. But overall, the percentage in Minnesota that they describe as being an urban population is 73%. Now, we wouldn't consider Kandiyohi County to be an urban area. We consider ourselves like a town-rural mix. So if you look at it that way, we are town-rural with one really large town, Wilmer, within ours. So if you look at our whole county, Wilmer accounts for about 45% of our population. That's another way that we differ a lot from our partners in Renville. So this one gives you a little better indication of what we may look at moving forward and seeing the changes, how we are really going to gain in our older population, those over 65. The projections are by 2030, we'll have 1 in 4 residents who are of retirement age. So as you can imagine, that's going to pose risks on both ends of the spectrum. It's I shouldn't say risks, challenges. There'll be a challenge for the workforce if 1 in 4 is of retirement age, and then the challenges that come with senior life in general. Some of the physical and social isolation. There are certainly positive sides to that too. In general, our seniors in Kandiyohi County are much more active in volunteer work. So there's good opportunities, but there's challenges that come with that as well. Some of the comments that we got from seniors that we interviewed as part of our gathering of data, this is one of them. One senior said back in the day there was more vibrancy and community connections with people. So people are feeling like maybe some of that small town connection is being lost. Some people don't have cars, so they can't go place. They have to rely on the bus or other people for transportation, which in some of our responses was good and some of it was bad when we talk about transportation. And again, we don't have a lot on transportation in this particular presentation, but in Willmar, in the city of Willmar, there's good opportunities for transportation, the bus. When you get in the rural areas, there's less opportunity for transportation. This slide gives you a little idea of the diversity that we have in our county, just separating out by white versus some other race. I can give you a little bit of idea of changes. So those population who identified as Black or African American increased from what was 1.9% in 2010 to 3.7% in 2016, while the non-Hispanic population decreased by 3%. We don't have really good data on what that projection looks like, so there's nothing in here that says that because there's no place that we can find that particular projection. But you can see a little bit of the data there. 7.1% were born in another country, and 12% were speaking or do speak a language other than English at home. Now we'll move a little bit to, oh no. This was the right one, forget it. Move along a little bit to disabilities. I'm not going to go deep into what the definitions are of a disability, but when we're looking at the data, it circles around those 6 types of functional difficulties. You can see them listed at the top there. Remembering that we are a regional hub, so we have a lot more people of disabilities that live in our county. Compared to the state, if you look on the graph there, we have a little bit higher number in the 18 to 64 range of persons with disabilities. Otherwise, we're not a lot different from the state. You can see and imagine that some of the challenges that those that have disabilities encounter. We did have a couple of comments from people that we interviewed in terms of disabilities. It's easier to take the bus than driving around. I've been taking the bus for years and feel safe. So again, there's a positive part of the transportation that we have. I live in Highland Apartments and pay for it according to my income, which I don't have enough. So that's more some of the challenges that are faced with this group.
So the next slide talks about expectant mothers and infants. And we know that the health of our community really begins with the health of our mothers and infants and children. Most of the births in Kandiyohi County take place at Caris Health, so we have a great hospital facility within our community. You can see that 85% of the births, the mothers receive good or adequate prenatal care. You can also, the other part of that, when you think about 85% receive good care, the other 15% receive little or no prenatal care. So while we have great benefits, we also have people that are have needs as well. 77.5% receive prenatal care in the first trimester, and that is really the gold standard. So again, it's great that 75% of our people, over 75% of our mothers received the gold standard for care, and then we still have to remember that we have 25% that did not receive that. You can see that there were 26.1% of the babies were born to mothers who have less than a high school education. And we know that risk factors for children born to mothers with a lower education include that the children might not be ready for kindergarten, they might not have the same educational achievement, that they have an increased risk of low birth weight and other health-related behaviors, including smoking and alcohol use. So certainly sets kids up to be higher risk for their whole lives. We also, you can see the teen pregnancy rate is above the state rate, which it has been for quite a while. I think a shift in that is that it used to be that we had mostly very young teens who were getting pregnant, and now the highest rate, 65%, is 18 and 19-year-olds. So they're older, so in some ways feel a little bit better about that, but then you can imagine that they probably haven't finished high school and done all the things that maybe parents would make their lives and their lives, children's lives better. The next slide. A little bit more about families and children. So 20% of our kids live in poverty, which is above the state rate. Almost 30% of the kids live in a single-parent household. And there's Kids Count data. That's an organization that gathers and analyzes data across the nation. And what the Kids Count Data Center says that children growing up in single-parent families typically don't have the same economic or human resources available as those growing up in two-parent families. So they're more likely to live in poverty, drop out of school, have or cause a teenage pregnancy, and experience divorce in adulthood. So even not only affecting just the childhood, but also going into their adulthood. The last sentence talks about the shortage of childcare spots, and I think if you've been keeping up on this in the community, there's great work that's being done with this. Some of the things that we know are risks for kids that if we don't have good childcare, it can impact children's childhood safety, it can impact growth and development, and it can also have a huge impact on our workforce and the economic well-being of the community, as well as local childcare providers. So very excited that there's things happening and people working on this. The next slide. I want to talk a little bit about adverse childhood experiences, and some of the things that I've been talking about a little bit kind of play into this. But adverse childhood experiences are traumatic events that happen to children before the age of 18. And the ACEs include all different kinds of abuse and neglect, as well as different parent health issues such as mental health, substance use, divorce, incarceration, and domestic violence. So all the things that kids could be exposed to when they're young. A landmark study in 1990 found a significant relationship between the number of ACEs that are experienced and a greater risk for poor physical, mental, and mental health, as well as substance abuse and risky behavior. So certainly, if kids have experienced ACEs, they are at greater risk. So this slide shows the percentage of Kandiyohi kids who reported ACEs on the PAC-4 survey that was done in 2016. That's what the yellow bars are. That's the percentage of kids that reported any of those things. And then if you look at the pyramid up in the right-hand corner, that demonstrates how if they experience abuse, then it can lead to some social and emotional and cognitive changes in them, and then lead them to maybe make choices to make some higher risk behavior activities, and certainly in the end it ends up affecting their health and in fact their mortality. So ACEs can have a huge impact on our population. The next slide shows how this is playing out actually in our own community. So this is actually a slide of showing both Kandiyohi and Renville County together, 11th graders that are using substances. And if you look at the bottom, the numbers across the bottom are how many ACEs that they've identified that they have experienced. And so you can see that even going from 0 to 1 increases the number in many cases, and then when you see going past 2, how the number shoots up even higher. So definitely has an impact and is an indicator.
So this side looks a little bit at our economy and industries here in Kandiyohi County. You can see that our median household income is lower than the state's, and the percentage of household incomes that are less than 25,000, again, in Kandiyohi County is higher than the state. There's a little indication there on our largest industries and our highest paying industries. Also of interest, which is not on this slide, we know that agriculture plays into the economy in our county. When we look at the two counties, Renville even more so, and you'll see more data on that in the community health assessment if you want to look a little deeper into cultural statistics. Whew, get my words out. So Kandiyohi County, we rank 10th of all counties in total agricultural production across the state. We rank 10th, but we are number 1 in poultry production. That's an interesting statistic, which probably we could have guessed that with the type of what's my word, corporation or manufacturing, what we have in our county. So our unemployment rate in 2016 was 3.3. And many of the jobs in our county, when looking at this, are shift work. There's lots of shift work, and there's a lot of people that are working more than one job, doing multiple jobs to make their ends meet. So if we want to look a little bit at environmental types of things, and again, we didn't include everything. You can see transportation is on there. We don't have our transportation data in here. So again, refer to the full CHA for more information, because environment, as you can see, includes all of these different areas, our parks, our drinking water, our air, our streets, our road, our housing, schools, all of that type of thing. It affects our health and so forth. So one of the interesting things that we came across, actually, I think it was Jill in Renville County, that came across and I think you have probably talked about it here before, but you can go to the Robert Woods Johnson, if you Google that and find where you can look up your life expectancy, what is wrong, by your zip code. So I did that just for myself to look at of interest, put my actual address in there. And I live rural. I'm a little bit, probably about 4 miles north of Atwater. So when I put my address and zip in there, my life expectancy is 84.8. When I look at Kandiyohi County as a whole, the life expectancy is 81. I gained 3 years living out there. When you look at the state, it's 80.8, and when you look at the entire United States, it's 78.6. So you can see there's a big variance by where you live, what you have access to. Rural life in general does pose, some challenges for us. We've talked a little bit about transportation, the ability, for roads, bridges, sewers, everything is more challenging sometimes in rural. The other thing that we found in a lot of our data gathering is that obviously everybody drives to work, the majority of us. So because transportation is not available out in the rural other than in town, everybody has to have a car, and that alone poses a challenge for some people in terms of income. 40% of us have 2 vehicles, 82% of us drive alone to work, and we drive an average of 17 miles. So that's just interesting information. So looking then a little bit more specifically on environmental stuff, this is some radon and arsenic data. You're probably all aware, because we've talked about this before at annual meetings about radon. Both Renville and Kandiyohi County do have high levels, higher than the state of radon. It's naturally occurring, so we certainly encourage people to get tests and to test in their own homes. That's the only way that they're going to find out if they have an issue. So in Kandiyohi County, between 2010 and 2016, 820 properties were tested. 71% of those had 4 or above, which is the bottom level of what you should have. Radon has been associated with lung cancer. We don't see higher rates in our county at this time, so that's certainly a good thing, but that there could be some issue with that in terms of exposure to radon. Arsenic is another a thing that occurs naturally, and this would be in our waters. So all of the public waters are tested and treated. So the concern is private wells. They are not routinely tested. Since 2008, any new wells would be tested, but anybody who's got a well that already existed, it is not being tested. So the statistics there, 759 wells were tested, and 30% of them had higher levels than what you should have, as opposed to the state was at 10.8%. So we are higher there. And there are a number of cancers that are related to high levels or high exposure to arsenic as well. So it's just something that we need to be aware of and encouraging and educating the public on that. So this slide will give you a little information about housing. We looked a little bit specifically within Wilmer, since that is our biggest city in our county, but also added in some general county data. So in terms of home ownership, about 59% of the people in Wilmer own their own home versus 73% across the county. 41% that rent. Yeah, that would add. I'm thinking my math wasn't right, but it is. Okay, so 41% of the people in Wilmer rent versus 26% across the county, and gave you some Minnesota and United States, just some comparison data. But we do know it's a cost burden for everybody, whether it is rent or home ownership. Added in, this is 2015 data on the median home value and owner income. That was the latest that we have in this particular information. The important thing to get on the slide was the last part, the median rent. So the rent has gone up 11% from 2010 to 2015, and the median renter income has gone down. So that it does become, as much as people want to own a home, it's becoming farther and farther out there that everybody is able to. A number of our homes as well in Kandiyohi County and in our partners, Renville County, were built before 1960, and not all of them have been kept up. 33% of our homes in Kandiyohi County were built before 1960.
Okay, we want to talk a little bit about access to food here, and you can see a couple of the comments on the slide there from our survey that we did. In Renville County, one of the residents said it's easier to get cigarettes in our town than it is to get food. And one of our Kandiyohi County residents talked about how expensive it is to eat the healthy food. 9% of our Kandiyohi County residents are low income and don't live very close to a grocery store, and so that compares to 6% statewide. So we have a higher percentage of people that have less access to grocery stores. We're fortunate in Wilmer that a lot of our grocery stores are in the Wilmer area, and Wilmer's somewhat centrally located in the county, but still 8% of the county residents travel more than 20 miles to get to a grocery store. A lot of the smaller communities have convenience stores, which do have packaged food, but not necessarily fresh food available. And statewide, it's interesting that statewide and locally, this is found from the Minnesota Student Survey, that more than 3/4 of ninth graders don't eat even one fresh fruit a day, and even fewer eat a green salad or other vegetable. And I think that probably by our diets, we probably know that is very easily true, but certainly reflects some of the challenge with eating healthy. This slide talks about access to health care. And access to affordable health care is really important to physical, social, mental health care. health insurance helps people have access to the needed care, but it doesn't necessarily ensure that they have providers available or that they can get to where in close enough proximity to where the patients are. You can see that for the providers, physicians, that we are probably in a little better spot than Renville County, or Renville County residents at least have to travel farther to receive health care. If you look at the next level, the next row down, that's mid-level practitioners. And so the more rural the area, hopefully the more mid-level practitioners there are in the middle, and the mid-level practitioners are the nurse practitioners, the physician's assistant, and the dental therapist. So they really help to stretch the provider access that people have. Let's see. And of course, one of our big concerns is the uninsured. And so we know that uninsured people are less likely to have access to a primary care provider. They receive less preventative care, dental care, chronic disease management, and behavioral health counseling. They are often diagnosed at a later stage, and so they have less treatable illnesses by the time that they do access service. And so, of course, then they have worse health outcomes, lower quality of life, and a higher mortality rate. Okay, so this is a cute picture, and I was going to show you a video, but the video is not going to run. So the video is about equity, and I think that maybe equity versus equality, and I think that all of us have heard some discussion about this. Minnesota consistently ranks as one of the healthiest states in the nation, and yet health outcomes and opportunities to live healthy vary greatly depending upon where you live and who you are. And so just always keeping that in mind, that just because, again, when you think about the prenatal care, that just because we have prenatal care available doesn't mean that everyone would feel like they have equal access. And so sometimes what's needed to be done to give people equity is not giving them the same thing, but giving them what they need. And so that was kind of the gist of the video. On to the next one. I'll talk a little bit about overweight and obese adults. So this is data from our 2015 health survey. You can see the area on the bars on the left are for overweight and the bars on the right are for obese. And so males with a high school or less education are more likely to be overweight in Kandiyohi County. And also those in all categories that have without education or have a lower income are more likely to be obese in the county. So one thing, the adults, the percentage who are overweight rose in 2010 to 2015. And while that might sound bad, actually the obese rate went down. So the overweight went up, but the obese rate went down. And so we're thinking that that is a good information that people are moving out of obese into overweight. So that's actually an improvement. So something that we certainly continue to watch and keep track of. The next slide talks about alcohol, tobacco, and other drugs. I'll talk a little bit first about alcohol. And in 2016, the CDC said that alcohol abuse was linked to 88,000 deaths across the nation. And that's more deaths than guns or opioids or even HIV at its peak. So alcohol, and I think that we can see this, has become more normalized in our society, and so that we don't often think of it as something that could be a contributing factor to things such as unintentional injuries, high blood pressure, stroke, heart disease, liver disease, malnutrition, and all those things are related to long-term use of alcohol. The great news for our county is that we've got the drug and alcohol coalitions that both Renville and Kandiyohi County have, and they work mainly with the young people in the communities, and we have actually seen alcohol rates go down in our youth in both of those areas, and so we just really want to thank the people that are starting to do some of that work. What we know is that if we can delay initiation of tobacco or alcohol use, the older we can delay that start has less health outcomes and also less chance of ongoing addiction. So delaying it is definitely good news. We'll also talk just a little bit about drugs and in our local drug task force, and I'm sure that you have heard this before. Local drug task force reports that methamphetamine is the most common drug that they deal with, and we know that all the impacts that has for children in the community and with abuse and neglect. So besides the health issues it causes for people that are using, it also has great impact on their families. Opioid and synthetic opioids are also very concerning, and one thing that's being done in our community at this time is that Caris Health and Public Health are working together on a federal grant, and that grant is working to reduce opioid use and also work with the providers who are prescribing, so reduce the initial prescribing and then monitoring and supporting people that are actually on the opioids. And so the last thing I'll talk about with this slide is tobacco, and this pertains more to the slide that's up. So tobacco remains the primary cause of preventable disease and death in Minnesota. Smoking cigarettes has decreased in both teens and adults, and you can see that on the little cigarette there that shows this is from the Minnesota Student Survey, that smoking, this is students, but the cigarette use has gone down from 6.7 to 6.4. What we're concerned about is the next one, where it's showing the increased interest in e-cigarettes. And we know that that has increased 2% from 15 to 2017. And on surveys, both teens and adults feel that e-cigarettes are safer than regular tobacco, and that they aren't exposed to as many harmful chemicals. But the CDC research shows that the use of e-cigarettes is unsafe for kids, teens, and young adults. And they contain addictive nicotine and other harmful substances. If you look at the last part of the graph of the picture there shows the Juul. It's a specific brand of e-cigarette. The Juul looks like a flash drive, so you can imagine how that impacts in school and how kids would be able to have it in school. Each pod contains as much nicotine as a pack of 20 cigarettes. So, and we know from the social media and from the news that the Juul is being used by students in school and in other settings. So certainly a concern with substance abuse.
So I'm going to move us along pretty quick through these because I know we're getting to the end here, but we certainly think that, or know that good mental health, mental wellness is important, and there's been lots of conversations around it. You can take a longer look at this graph later, but the fact of the matter, we want everybody above that line. Because you have a mental illness diagnosis does not mean that you can't be flourishing. So it can be controlled and be flourishing. And we want everybody who doesn't have a mental health diagnosis or mental illness to be flourishing as well. That is certainly our goal all the way around. So this is just a compilation of some data. Again, that doesn't look right. If you're seeing the same thing I am on the categories over there. Anyway, you'll see this in your community health assessment document that you have. But the two boxes on the left are important. We're seeing some struggles in both our youth and our adults. So the youth, if you look between 2015 and 2017, it has increased. So 25% of our youth in 7th, 9th, and 11th grade all across our county are saying in the past 12 months, I felt so sad or hopeless for 2 or more weeks in a row that I stopped doing some of my normal activities. That's very relevant data, and we need to think about that and look at ways we can help make changes there. And when you look at the adults, again, this is 2015, that's the last time an adult survey was done, but adults are struggling as well. On the question, thinking about your mental health, which includes stress, depression, and problems with emotions, how many days during the past 30 was your mental health not good? 28% said between 1 and 9 days. That's significant as well. The graph on the right, that's not the way it's supposed to look, but you'll, look at it in your actual document. This is data from the Mobile Crisis, and I know you guys have heard from Woodland Center Mobile Crisis up here, so you're somewhat aware of what they are doing. But this gives you an idea of the percentages of what their calls have been in their whole region. This is not specific to Kandiyohi County. We do know that there was 170 dispatches in our county in 2016. Half of those were adults, half of those were youth. So when you look at death, causes of death, this is what you're going to see when you actually look at death certificates for Kandiyohi County. Our number one cause of death is heart disease, number two, cancers, right on down the line. When we think about that in public health, we look at it from a little bit different lens and try to look at what are the risk factors that are leading to these types of deaths. So I'm just going to move through this. You guys can look at that in your document.
Okay, so I just want to spend a minute just telling about the process. So we have, the first thing that we ended up doing was putting together our community health assessment. And then we were using something called a MAP process, which is really involving the community. And we talked about this at the beginning, involving the community in the work that we're doing so that it's not just public health plan, but it is our community plan. So we started about a year ago having community meetings with Caris Health and some of the other healthcare providers and having some discussions about working together and how we can work together. In November, we gathered a group of community citizens and we asked them to help us decide on top 10 priorities that are important health issues for our community. So from those top 10 health issues, we ask our Kandiyohi County, Renville County Advisory Board to help us narrow that down because we knew that we couldn't possibly even begin to think of working on 10 top issues. So they helped us nail it down to 2 different priorities. One of the one that we worked together with Renville County, we're thinking is mental health, and then also substance abuse for Kandiyohi County. So we have started now that we have our topics narrowed down, we're finishing up with meetings that will help us come up with our strategies and outcomes and actually develop a action plan so that we can hopefully start to make some movement. And again, depending on our partners, that this isn't something that public health can do by ourselves, but we really need to be working together with all of our partners. Flip over that one. Okay, and this is just our timeline. So we, by March of 2020, we have to submit our documents to the Minnesota Department of Health, our strategic plan, but we hope we'll be taking it to board at the end, the Community Health Board by the end of this year with our complete Community Health Improvement Plan.
So we whipped through a lot in a little bit of time. Certainly, as you read through the community health assessment, if you have questions, you can reach out to Jenny or you can reach out to us. I forgot to mention that document is also on the website. So if you go to Public Health's, Kandiyohi County, and then to Public Health, you'll find that assessment. So if anybody in the public wants to seek it out, that's where they can find it.
I'm going to suggest, Jenny, that as we move forward, that we deliberately set some times to, again, have some follow-up and to gather some more information. Again, it is a tremendous amount. We went through the Board of Health clearly and had about the same length of time, and it's overload at this point. I have a question for the board. In the nation, what is the number one ACE? Number one ACE in the nation, as reported by kids and adults, the number one.
Are they the same ACEs as Minnesota has?
Yes, it's the same, this is a universal definition, Commissioner.
Okay.
What is the number one ACE?
I would say it reflects Minnesota's number one ACE in parental separations.
Okay, that's what I thought too. The number one ACE in the United States is being a child of an incarcerated parent or guardian. The
In
number one
severity
ACE.
or in quantity?
In quantity. The number one is 16% of all the ACEs. By far, the top one is being a child of a parent or parents or guardian or guardianship that is incarcerated. It is far outranks all of the others. They're all severe. That was a shocking statistic that was brought forward last week at the SHAC committee as the report. That astounded me. So as you peruse the documents, again, as Sherry and Denise said, if there's any questions or comments, please do, but also consider looking at a follow-up at this point in time. Jenny, do you have any administrative? Thank you very much. Appreciate it. Jenny, administrative? updates?
I just have a couple here. So I wanted to announce that Sherry Johnson, our public health supervisor, who is presenting today, has put in her notice of retirement, and she will be leaving us on August 31st. So we want to thank Sherry for all of the years of service she's given to Kandiyohi County. She's been here for over 26 years in the public health department, and we have posted her supervisory position, so we'll be holding interviews. But again, Sherry, thank you for all the time and efforts that you've put into this. And also, this is a lot of work to do the CHA and the CHIP, and the amount of time that both Sherry and Denise and the public health staff have put into it. I strongly encourage anybody that's watching to go onto our website and take a look at the statistics, because it's really good information that we have here.
Again, I would echo Jenny's comments. Thank you very much.
Congratulations.
And I will now turn the meeting over to Mr. Kleindl to give us an update as far as the next few weeks.
Sure. Mr. Chair, Commissioners, I just want to let you know what the coverage plan, as you know, Jenny is going to go on medical leave, on maternity leave coming up. And so we have to have a plan how we're going to do the coverage, and we've been having discussions and looking at different ways to have this type of coverage. The good news is we have a veteran staff. Our management team is well-versed and they know their jobs, but we still need that day-to-day oversight and support for them. And so my recommendation to the board is that we have Tammy Jo cover for 4 to 6 weeks while Jenny is out full-time on maternity leave. Tammy Jo then, per our county policy, would be working out of class, covering approximately 20 hours a week downstairs, meeting one-on-one, answering questions on it as needed, and then also approving timesheets and stuff. Any other signatures and stuff that aren't covered under the transitional resolution that you passed for the supervisors to sign or Carol to sign, I would ask that you authorize me to sign any forms that aren't covered under those resolutions.
You heard the suggestion. I'll entertain a motion.
So moved, Mr. Chair.
Mr. Imdek moves. Is there a second?
I'll second it.
Seconded. Discussion, questions?
Will that be for any, excuse me, Mr. Chairman, would that be for grants or authorization?
Anything that comes up, say DHS comes up or Department of Health that's not covered under the plan that would need immediate signature and couldn't wait, I would sign those.
All right, thank you.
Most of those will be addressed by the transition document already, but there could be those exceptions. So I think a good plan, good plan, and I appreciate Tammy Jo being able to step up to that. It's a good segue and a good transition and good discussion. Further questions or comments? If not, the board is asked to vote either aye or nay. All in favor, please say aye.
Aye.
Opposed, same nine. Motion is carried.
So when Jenny comes back, the next, she'll come back part-time in about 4 to 6 weeks after her due date. And then she'd work part-time for another 4 to 6 weeks. Approximately November 12th, she'll be back full-time.
And congratulations again.
Thank you.
Best wishes.
Yes, thank you.
And with that, we're adjourned.
When do you go out?
I can run down.
Oh, they're learning.
So I'm counting, yes. We'll see.